this video, what I will be doing is I'll be doing a complex wound care of the abdominal incision, and that is for my patient mortuary. I've already gathered the supplies. I'm in the patient's room. The overbed table is clean. I'm comparing the order to the wristband. Mortuary, fin 999, 999, 888, 888, 777, 777. Hello, sir. My name is HongYang Lin. I'm a student nurse. Please tell me your full name and your date of birth. Thank you. The reason I'm here is because I'm doing an abdominal incision wound care on you. That consists of removing the old MeFix and 4x4s and old roller Kerlex, irrigating, packing, and putting on new 4x4s and new MeFix after doing a thorough assessment as well. Is this all okay with you? He says it's okay. I give him his fentanyl PRN medication before the wound care happens. I wash my hands, and now I open up all my supplies. I have my ruler set up over here. Garbage bag, which I will open up like this. Here's my sterile drape. And here's my silver forceps. And now what I will do is I'm going to add 2x2s and 4x4s. A 30cc syringe and a 20 gauge IV Cathlon. A wing back. In clinical practice, I'd make sure to have it fully peeled back and keep it peeled back, and that way is the best of maintaining the sterility. .20 gauge IV Cathlon. Cotton tipped applicators. And I'm going to add sterile scissors and my roller Kerlex. and my normal saline is not expired. I wash my hands and I put on my clean gloves. There is reddish pink serosanguinous drainage and there's a small amount of odor to it. On the old roller Turlex, there is also reddish pink serosanguinous drainage and there's a small amount of odor to it. I wash my hands. For the rest, I'm going to need sterile gloves, and that includes irrigating and drying the peri-wound skin and drying the inside and assessing the overall wound. I have at least 10 cc's, actually almost 15. I irrigated all of it, so that's at least 10 cc's irrigated. None of it went on the peri-wound skin. 4x4 folded in half. Dry the inside, discard. 4x4 folded in half. Dry the inside, discard. 4x4 folded in half. Dry the inside, discard. And now wet the 2x2 rosette in normal saline, and I do the peri-wound skin. One swipe top to bottom, discard. That was the left side. Right side, and now I dry it. Left side, discard. And this is the right side, discard. And now I will assess the wound dimensions. Firstly, just by looking at it, reddish pink, there was a small amount of serosanguinous drainage, mostly granulation tissue, and appears to be healing by secondary intention. height of 15 centimeters, width of 3 centimeters, depth of 2 centimeters. I'm looking for tunneling and undermining and gently going around the entire circumference of the wound. No tunneling, no undermining. And now what I will do is I will pack the wound. So like I said, it was granulation tissue and it was healing by secondary intention. So here's my roller Curlex. If I need, I will cut off the excess in order for it to fill thoroughly of all the edges. I made a small mistake in a bit of the Curlex went to the peri-wound skin area, but good thing it was the peri-wound that I cleaned. In real clinical practice, my goal is to minimize that as much as I can, because the roller Curlex, despite going on the peri-wound skin that has been cleaned, it's not good because it can harbor the bacterial organism, which we don't want. So here's my extra that I cut off. Here's 2 of my 4x4s. I was told my hands no longer need to have sterile gloves on them when I am applying on the MeFix, and that makes it a lot easier to put on my MeFix. Thank you, sir. What I do is I do my exit safety check and I document all my findings about the wound, including dimensions. It's mostly reddish pink granulation tissue healing well by secondary intention. These are things that I would document on the wound care flow sheet as well as the IPN, and I clean up all my things.